My name is Cher-Rin Chong. I'm a postdoctoral research fellow here at University of Adelaide. My research interest is understanding how type 2 diabetes affects the human heart. Type 2 diabetes affects 1.5 million Australians, and the lifetime risk of developing heart disease is 1 in 3. Ideally, I would like to find a way to prevent heart failure in patients with type 2 diabetes. Currently, there are treatment options available, but these treatments are fairly limited. So I hope that with my research, I can find a way that contribute to the wealth of knowledge out there. I was trained as a pharmacist and I worked as a hospital clinical pharmacist for almost 10 years. I felt that within clinical practice, we are always constrained by what we know. Doing a PhD gives me the opportunity to explore what is unknown out there and to find out answers for questions that I'm always curious about. I did my PhD training here at University of Adelaide. In 2016, I was awarded the Nephew Medical Fellowship, which allows me to continue my research training at Oxford University. Now coming back to Adelaide University, I feel that the research supervision and training that I have here is not only world-class, but also has supported me and provided me the necessary foundation to continue my research pursuit. My work involves investigating drugs of interest in type 2 diabetic heart in an isolated heart setting. I work on preclinical model of type 2 diabetes. So in the lab, we set up environment that mimics the human's heart with type 2 diabetes, and we test out drugs to see whether or not they help the type 2 diabetic heart to cope with stress. I hope that one day cardiovascular disease is no longer the #1 killer in patients living with type 2 diabetes. I hope that my research can contribute to a portion of overall scientific knowledge to help to tackle this problem.